We at Humana believe that the world is changing. We think that the fee-for-service model is less ideal for our patients, and we think that beginning to pay caregivers for value is really the central answer to so many of our problems in our society. So fundamentally, we're pushing towards value, and we're pushing for outcomes. So we're not looking for, did you just do this service, but did you do this service and was it a benefit to the patient? Well, we've been working with thousands of patients in many states at this point. We have found that the value that these relationships bring include better control of diabetes, better control of eyesight, decreased risk of kidney problems associated with diabetes. The entire change of attitude has resulted in global increased quality, and our HEDIS scores have increased dramatically. At the same time, the benefit to the patient is dramatic. I've been a practicing physician for more than 23 years. I think that the people who understand best how to bring value to patients are frequently the physicians, the caregivers, the clinicians who are rendering care. They're the ones who are usually up to date in terms of evidence-based medicine, and they should collectively be given freedom to help an individual patient in the context of a big population, and at the same time, by doing this, one allows the physician to be more responsible for the care of their patient. I think that as a provider, I understand what physicians want and heartily endorse this increased responsibility that physicians take in the care of the individual and of the population as a whole. So hospitals are vital parts of our healthcare system, and I don't ever see that it's an us or them or provider versus hospital. We all have critical roles to play within this complicated orchestra, this complicated symphony that is the care of our patients. Hospitals are very complex organisms. You know, the emergency room is something that has to be staffed. The operating rooms are crucially important in the care. The complexity, I believe, is going to come in how do you appropriately rank order particular patients' 4 levels of care. So the sickest of the sick should be in the hospital. But the hospitals in the past have sometimes looked and said, well, we have patients who could go into same day, overnight, or alternate systems, but there was no incentive for them to do so. So I think what accountable care does is it begins to align incentives. And the incentives are, collectively we want to spend less money, but we want to have better care. And the two are actually perfectly aligned in doing things well by using evidence-based medicine. So hospitals are a great partner and a needed partner. At Humana, we have and are in the midst of transforming from an insurance company that literally wrote checks out to providers and hospitals for a service. We've pivoted at this point to being an organization which is working with providers, physicians, hospitals, nursing homes, etc., so that we have this vast exchange of data. that that we're transparent in what our members want, and that we're working together in this. So yes, I agree. I think you're going to see Humana and other organizations becoming very engaged in the health and wellness of all of our members. And as members become sick and become patients, we're going to be actively involved in managing their care.